ADP ribosylating toxin of this organism inactivates EF2 leading to pseudomembranous pharyngitis. Corynebacterium diphtheriae, Pseudomonas also inactivate EF2 but more closely related to burn victims, not pharyngitis. ADP ribosylating toxin of these organisms leads to G protein stimulation of adenylyl cyclase. B component has a preference for intestinal epithelium. Vibrio cholerae, E. coli has a heat labile toxin that works in a similar manner to cause watery diarrhea. The toxin of this organism kills enterocytes resulting in pseudomembranous colitis. C. Difficile, often secondary to the antibiotic clindamycin or ampicillin. Endotoxin activates the release of what factors from macrophages? IL-1, fever, TNF, fever, hemorrhagic tissue necrosis, no, hypotension. How would you distinguish strep pneumonia from viridans streptococci? Both are catalase negative, strep, and alpha hemolytic. Pneumo is optogen sensitive and viridans is optogen resistant. Treatment for gram-positive rods forming long-branching filaments resembling fungi. Actinomyces israelii and Nocardia asteroids, SNAP, sulfa for Nocardia, Actinomyces use penicillin. The outer membrane layer of these organisms inhibits the entry of penicillin G and vancomycin. Gram-negative bugs, some may, however, be susceptible to derivatives of penicillin G such as ampicillin. This organism causes pneumonia in alcoholics and diabetics with a red currant jelly sputum. Also, the cause of nosocomial UTIs. Klebsiella, 3As, aspiration pneumonia, abscess in lungs, alcoholics. In vaginosis, greenish, vaginal discharge with a fishy smell, what would be expected under the microscope? Gardnerella vaginalis, clue cells, or vaginal epithelial cells covered with bacteria. What is the treatment of H. pylori? 1. Bismuth, metronidazole, and TTC or amoxicillin. 2. Metronidazole, omeprazole, clarithromycin, expensive. The patient presents with a rash on palms of hands and soles of feet. What is the differential? Rocky Mountain spotted fever, rickettsia. Syphilis. Coxsackie, hand, foot, and mouth disease. What are the two forms of chlamydia? An elementary body which is the extracellular form that enters the cell by endocytosis, reticulate body which replicates in a cell by fission. What is the ARGYLL-Robertson pupil and what is it pathognomonic for? When the pupil constricts for accommodation but is non-reactive to light. Pathognomonic for tertiary syphilis. This fungus is usually introduced by trauma, typically by a thorn, rose gardener's disease, causing local pustule or ulcer with nodules along draining lymphatics. Sporothrix schenckii. Larvae of this organism penetrate the skin of feet leading to intestinal infection and can cause anemia. Ancylostoma duodenale, hookworm. Strongyloides stercoralis is similar but does not cause anemia. What is the treatment of hookworm, pinworm, roundworm, and strongyloides? All are treated by mebendazole, parental pomote except strongyloides, which is treated with ivermectin, thiabendazole.